keep Erie County students, faculty, and school staff, and everyone's respective families and loved ones safe from the severe effects of COVID-19, the Erie County Department of Health has ordered that masks be worn for all public and private primary and secondary schools in Erie County. The order began on August 23rd and will be in effect until further notice. In addition, Pennsylvania Secretary of Health Allison Beam has ordered that masks are to be worn inside K-12 school buildings, early learning programs, and child care providers. This order began on September 7th and will also be in effect until further notice. Why is there a masking order for schools?
So Erie County Department of Health's masking order is in response to the increased transmission of COVID-19 in Erie County. The Department of Health wants to prioritize our children's education and social growth and well-being. In-person learning is preferred choice for most families, including families like mine. Masking while indoors provides a layer of protection when combined with other protective measures such as social distancing, hand washing, adequate ventilation, and the risk of infection from COVID-19 greatly decreases. Masking helps to reduce the need to quarantine and helps prevent the loss of time at school or work due to the exposure of COVID-19. Masking by everyone in schools, regardless of their vaccination status, is recommended by the Centers for Disease Control and Prevention, what we often refer to as the CDC, and the American Academy of Pediatrics. The CDC recommends wearing a mask indoors for all people in areas with a substantial to high transmission rate of COVID-19. Erie County is currently in a high rate of transmission.
What law authorizes the masking order?
Pennsylvania's Disease Prevention and Control Law of 1955 that authorizes the Erie County Department of Health to order the wearing of masks. This law gives local departments of health the authority to authorize appropriate control measures in order to respond to communicable diseases and outbreaks. This law allows the Erie County Department of Health to supersede school administrators and school boards. In the case of a COVID-19 pandemic, this ensures the mitigation efforts being followed are the best practice and evidence-based in order to keep our children safe and avoid interruption to learning.
Is wearing a mask safe?
Wearing a mask that covers the mouth and the nose has been proven to reduce the spread of infectious respiratory illness such as COVID-19. And according to the CDC, studies on the effects of wearing masks have proved that there is no change in oxygen or carbon dioxide levels where people wear cloth or surgical masks while resting and exercising. And when my children practice and understands the importance of wearing a mask, they feel confident and even proud to wear their mask, and they have a level of comfort.
What is the proper way to wear a mask, and what kind of materials should they be made of?
As recommended by the CDC, choose a mask that completely covers your nose and your mouth, that fits snugly against the sides of your face, and do not have gaps. Have a nose wire to prevent air from leaking out of the top of the mask. Have 2 or more layers of washable, breathable fabric. Do not choose a mask that are made from fabrics that make it difficult to breathe, such as vinyl. Don't choose a mask that has the ventilation valves or vents that allow a virus particles to escape. And don't choose a mask that is prioritized for healthcare workers, including the N95 respirators. Be sure to wash your hands or use hand sanitizer before putting on your mask. And do not touch the mask when wearing it. If you or your child often have to adjust your mask, it may just mean that the mask doesn't fit well, and you may need a different mask or need to make adjustments. Don't wear the mask below or under your nose, or only on your nose or only on your chin. Remove a mask by holding them by the strings of your ears. fold the outside corners together and wash your hands immediately after. Reusable masks should be washed at least daily and whenever they get dirty. Disposable masks should be thrown away after wearing them once. Masks can be included in a regular laundry and dried in a dryer, under the sun, or hung out or laid flat to dry.
How can I help my child get used to wearing a mask?
It's understandable if your child seems afraid of wearing a mask at first. Here are a few ideas from the healthychildrens.org that might help make them more comfortable. Look in the mirror with a face mask on and talk about it. Put a mask on a favorite stuffed animal or toy. Decorate your mask so that they're more personalized or more fun. Show your child pictures of other children wearing a mask. Draw a favorite comic book or book character wearing a mask. And practice wearing the face mask at home to help your child get more used to it. For children under 3, it's best to answer the questions simply in a language they understand. If they ask about why people are wearing a mask, face masks, explain that sometimes people need to wear them to stay healthy. And for children over 3, try focusing on germs. Explain that germs are special to your own body. Some germs are good and some germs are bad. The bad ones can make you sick. And since we can't always tell which ones are good or which ones are bad, a face mask will help to keep those germs away from your own body. The good news is children have gotten used to masks and are less likely to feel singled out or strange about wearing them. It kind of has quickly become the new normal, and for all of us. So for other guidelines and tips, you can visit the Centers for Disease Control website at cdc.gov or approach a professional healthcare worker such as your pediatrician, or you can even contact the Erie County Department of Health at 814-451-6700.